everyone. My name is Brenda Stubbs, and I'm the Triad Regional Program Coordinator for the March of Dimes North Carolina Preconception Health Campaign. Is everyone here familiar with March of Dimes?
Yes.
Yes. Oh, good. Then if you are, you know that all of the work we do, whether it is research or training providers or doing community education like this, all of our work is in the effort to prevent prematurity, birth defects, and low birth weight. So this lesson that I'm giving you today, called Healthy Babies Are Worth the Wait, is about encouraging you not to choose an early elective delivery and to try to stay pregnant until you are full term. Unless there is a medical emergency, of course. So we're also going to talk about why that is so important to get to at least 39 weeks of pregnancy. And before I get started, I always like to preface this by saying this information is not meant to scare you. It is meant to inform you, because the better informed you are, the better decisions you can make for you and your baby. So with saying that, I want you to keep in mind that most babies are born full term and healthy. We're going to be talking about the risks of prematurity today, but I do want you to keep that in mind, that most babies are full term and healthy as we go through this presentation. So what is full term? How long is your pregnancy going to last?
9 months.
Yeah.
Too long.
And you know what? If you walk down the street and stopped anyone and asked them, almost everybody would say 9 months. But guess what? 9 months times 4 weeks is 36 weeks. And that is not full term. That is actually preterm, according to the newest definitions. But you know what? You would not be alone, because actually statistics show that more than 30% of women believe that 36 weeks is full term and safe to deliver. And that is not the case. So let me give you the definitions of term pregnancies. So now the medical experts are saying it's best to get to 39 to 40 weeks to give your baby the healthiest start. So 39 and 40 weeks are full term. 37 and 38 weeks are considered early term, and anything prior to 37 weeks is preterm. And so that's what I was just talking about a minute ago about the 36 weeks. That is considered premature. Now let's talk about why it is so important to get to at least 39 weeks of pregnancy before you deliver. I think a lot of us have long known the medical consequences of premature birth. It's things like higher NICU admissions, and if you don't know, NICU is the Neonatal Intensive Care Unit. It's also longer stays in the NICU. There's often more need for ventilator support, and there are higher rates of respiratory distress syndrome, along with more learning difficulties, as well as difficulties with seeing and hearing, and feeding as well. But what we also know through more recent research is that there are mental and behavioral health consequences as well for babies that are born even just a few weeks early. And we'll talk more about that in just a minute. But first, let me ask you, especially those of you who are in your last trimester of pregnancy, just call out some reasons why you might be uncomfortable as you get further along in your pregnancy.
Back pain.
Yes, that's one.
You can't sleep. The belly's too big.
Yep, that's right.
Appetite changes.
Exactly.
Too much going to the bathroom.
Yes, I can definitely relate to that. And these are all very common and very valid concerns. And we don't want to discount that at all. But we just want to make sure you know that the medical experts do say getting to 39 weeks is going to give you and your baby the healthiest start. So as I just mentioned a little bit ago, so we do know now that babies born even just a few weeks early do have higher rates of neurodevelopmental, behavioral, and mental health disorders. So do y'all know why that might be? Okay, well, I'm going to tell you. At 35 weeks, your baby's brain only weighs 2/3 of what it will weigh at 39 weeks, and it's also only half the size. And you can see from this picture, and I know this is sort of a cartoon image of the baby's brain at 35 weeks and the baby's brain at 39 weeks. But you can see the obvious differences in the size of the brain. But what else do you notice?
The bigger brain has a lot more involved. It's more little squiggly lines.
Yeah,
inside
more
of the big
detailed. Exactly. Well, what that is, and I'm not going to get too technical here, but do any of you remember back to Biology 101 in high school, learning about the myelin sheath in high school in biology class? Well, the myelin sheath, think of it as a protective coating over the nerves and the fibers in your brain. And what happens is when you hit 14 weeks of gestation, that myelin sheath starts gradually developing throughout your pregnancy. Now, why that's so important is because the myelin sheath is essential for proper functioning of the central nervous system. So it has a lot to do with your brain circuitry and how we're all wired. So when you get to 35 weeks, all of a sudden the myelin sheath multiplies 5 times in your baby's brain. And this critical brain development in the last few weeks of your pregnancy is absolutely crucial to your baby's brain development. I also know that the frontal lobe, which is this part right here, is the last to develop, and so it makes it the most vulnerable. And we know that the frontal lobe is responsible for critical thinking, judgment, impulse control, things like that. So that is one of the reasons why this research is showing that babies who are born early and miss out on this critical brain development in the last few weeks of pregnancy are having higher incidence of developmental delays, anxiety, depression, ADHD, autism spectrum disorders, oppositional defiance disorder, and OCD, which is, if you don't know, it's obsessive compulsive disorder. So that is one of the main reasons why it's very critical to get to that 39-week mark in your pregnancy. And there are some things that are considered medical emergencies that may cause your provider to want to deliver you early. And for more information on that, you can go to our website at www.everywomannc.org.